Welcome to the Thursday edition of Wave 3 Listens. We're at the Physician Center for Beauty. Dr. Sean McGuire is here, and we're fielding your phone calls. Anything to make you look better, feel better. That's what it's all about at the Physician Center for Beauty. And I'll tell you what, Doc, it's for what you do, this has to be a nice time to be working in your business because the industry is full of all kinds of new technology, and everything's very effective, and you get great results.
Yeah, no, technology is constantly improving, and actually not everything works. I mean, there are some devices and things that have come and gone, but we're seeing a constant improvement in technology and some less invasive procedures that are pretty effective. And of course, cosmetic and surgery is always improving in technique. All
right, let's go to Barbara, who is with us today. Barbara, welcome to the show. Hello, Barbara.
I have a question.
Sure.
Can you do anything about sagging eyelids?
Sure. That's a good question. I'm going to be demonstrating a procedure down here in the office to improve the appearance of dark circles and also the hollowness that some people have underneath the eyes, which accentuates the bags. But there's also surgery that's done, and we've been doing that for a long time to improve bags or aging of the lower eyelids, and that's something that's done on an outpatient basis, and it's a pretty straightforward procedure, very common.
All right. Let's grab another caller here. I think Kim is with us. By the way, Barbara, thanks for the call. Kim, welcome to the show. You have Dr. Sean McGuire.
Yes, one comment and then a question, if I could. I did do the HCG diet, and I was thrilled. I had great results. I lost like 24 pounds in 30 days, and that's about all I needed to lose. So I was really excited.
Yeah.
After the fact, like all of us, I'm like 53. A little bit of sagging in the face because of the weight loss. So I didn't know. I'd heard something about that. Is it EXILIS, Exilis? Is that correct?
Yeah.
What do you think about that? And would that be something good? I mean, I'm not, like I said, it's not horrible, but just would like to lift a little.
Well, first of all, congratulations on losing 44 pounds with HCG. That's amazing. But I think you bring up a really important point, which is, weight loss is great, and we think, in general, that skinny is better than overweight. But sometimes losing a lot of weight in the face can age us, and as we lose volume in the face, things can look a bit older and sagging and tired. So one of the things that we do, we've been doing more and more volumizing of the face with procedures, either fat grafting or with injectable dermal fillers. And the other technology which you mentioned is Exilis, which is a non-invasive skin tightening procedure done here in the office. It's also for spot fat reduction and skin tightening of the face and neck. So it's a procedure done here in the office, usually 4 or 5 treatments done over a period of about a month. And for the right patient, it works very well. It's one of those things that, if I could evaluate you and take a look at you and talk to you, kind of figure out what might be the best option.
All right. And thank you so much for the calls. Your call is welcome at 571-5263. All right. I'm excited about this because I've not seen this procedure here at the Physician Center for Beauty. Doc, tell us a little bit about what we're going to be seeing. A Glytone peel?
Right. So Glytone is a great skincare line. It's a prescription skincare line that we've carried here for a long time. It's a great company based out of France, and they have several different types of chemical peels. This particular chemical peel is kind of unique in its application system. So it's actually in a pen form, and it's applied around the mouth and the eyes, and it's actually a fairly simple, short procedure that works really well for the area around the upper and lower eyelids and also the lines around the mouth and the lips. These are areas that are difficult sometimes, and with chemical peels, traditional chemical peels, we've had a difficult time going right up into the lower and upper eyelid, and with this particular application, we're able to do that. It's something that usually peels for a couple, 3 days, and then just works on fine lines and wrinkles, on crepiness of the skin around the eyes, on hyperpigmentation or dark circles, and crepiness of the skin is tightened, and it's a really nice treatment, fairly cost-effective. Around the mouth, we also can improve fine lines and wrinkles and some of the texture issues that sometimes we get as we get older, and it's a procedure that we're very excited about because it's kind of unique.
Sure, and Doc, I would think for those of our viewers who may smoke, I would think perhaps some of those fine lines you could help with that because, as you know, from drawing from a cigarette, you get these lines. Squinting, if you're in the sun a lot, this could help your skin in that regard.
Sure, all those things have an effect, and even if you're not a smoker, those lip lines can be problematic for a lot of women and men. And there are some things that can be done for that, whether it's a chemical peel or injections of dermal fillers or fat augmentation. And those are all things that are done, pretty straightforward procedures that are done here in the office. One of the issues with the area around the mouth and the lips is as we get older, the lips shrink. We lose volume in the lips, and as the lips shrink, the skin around the lips kind of pleats. So part of that is an issue of volume loss, and part of it is an issue of the skin, sun damage, and smoking.
Right, that makes perfect sense. I'm curious now, if someone wanted to have the peel, as we're seeing here on the screen, and wanted to have a dermal filler, could you have those procedures back-to-back the same day, or do you recommend, Doc, that they come in at a different time and have it done on a separate occasion?
No, in fact, they can be done together, and we're offering actually a special if you are doing dermal fillers, you actually get the peel at a discount. So they certainly can be combined, and we're doing that quite often. We don't have a problem doing it. It's with laser. It's interesting if you're doing laser over dermal filler injections, that can be an issue because the heat generated from the laser sometimes can cause the filler to degrade over time and goes away more quickly. But with a chemical peel, we're really treating the superficial skin around the eyes and around the mouth in this case, and it's something that can be combined with dermal fillers at the same time or Botox.
All righty. Well, thank you very much. There you go. That's the Glytone peel, correct?
Yeah.
And it looks relaxing to me, and I'm not aware if that's what's the case.
Well,
but
it's not particularly painful. Some of the chemical peels are, you feel pretty hot. I mean, there's some discomfort with them. This one is not particularly bad.
All right. We'll take your questions. 571-5263.